So, in this presentation, I am going to discuss on what is called the TIRADS classification of thyroid nodules. My name once again is Mr. L. Chitumba, specialist ultrasonographer and a clinical ultrasonographer. So, most of you have heard about what is called the TIRADS classification of thyroid nodules. Today, I am going to discuss on the TIRADS calculator, show you how to use it to classify different thyroid nodules, to predict the risk of malignancy, and also to assess when are you supposed to do a follow-up. You also have to assess when are you going to recommend a biopsy. So, what is the TIRADS system of classification? TIRADS simply stands for Thyroid Imaging, Reporting, and Data Systems. So that's what it stands for: Thyroid Reporting and Data Systems. So it was discovered for a good cause. So the basic reason why an effort was done to discover this system of classifying thyroid nodules was to stratify the assessment of risk of thyroid nodules. So for the purpose of stratification and reproducibility, they came up with this method, which we now call the TIRADS classification. It was first proposed in 2009 by Harvard and his colleagues. So these guys, they did a very tremendous job to discover or to propose the TIRADS classification, which is now universally accepted by most organizations and in most nations. So the American College of Radiology adopted the TIRADS classification, which was also adopted by the European Thyroid Association and also the Korean Society of Thyroid Radiology adopted it. So I want to show you in this module how we calculate the risk using what is called the TIRADS calculator. So you don't have to worry to say where will I get the calculator from. The calculator, you find it in your Google page. So if you just open your Google page here, then you type TIRADS calculator, TIRADS calculator. You see it's already there. So here you can see it's there. Then you just click it. So now we have opened the TIRADS calculator there. So you can see the calculator. There is the calculator there. So what do you do, or what are you supposed to do? You are supposed to do your sonar of the thyroid gland. document or save the images of the nodules. Then you are supposed to characterize the nodules into 5 different categories. We do have got here, which is called the composition, the first classification, then according to the echogenicity, thirdly, according to the shape, then fourthly, according to the margin, then lastly, but not least, you are supposed to talk in terms of the echogenic foci, if there is anything. So these are the areas which you are supposed to look for. At the same time, when you are using the TIRADS classification, I want you to know it's a bit different from how you classify other lesions from the pelvis. For instance, you have to take note of the intralesional vascularity or the blood flow inside. But for the assessment of malignancy or suspicious lesions in the thyroid, you don't necessarily use the intralesional perfusion as an indicator of malignancy, because that can be misleading when it comes to thyroid nodules. So how does this classification work? So you are supposed to come here under the composition. You have to check if the lesion or the nodule is cystic or almost completely cystic portions. Then you tick it here. If it is a spongiform, you tick it there. If it is mixed and solid, you tick it here. If it's solid or almost completely solid, you tick it there. So you assess classification by classification. Let's say that the lesion that you are seeing together is entirely cystic. We come here and tick there on the calculator. Then you come again here. In terms of the echogenicity, you see anechoic, hyperechoic or isoechoic, hypoechoic, very hypoechoic. So let's say that the lesion that you are dealing with is anechoic, then you tick here. Then you go to the shape, wider than it is tall, taller than it is wider. So let's say it's wider than it is tall, then you just tick there. Margin, smooth, then ill-defined, lobulated or irregular, extrathyroidal extension. Then let's say this is our lesion is smooth, then you pick it there. Echogenic foci, none or large cometal artifacts, macrocalcifications, peripheral rim calcifications, punctate echogenic foci. So let's say that our lesion is with none or echogenic foci, then you just click there. So you see now, we are done with the classes, 5 classes. So you check the total points. The total score is 0. So according to this lesion, our score is saying is classified under TIRADS classification 1. So recommendations is benign, no need for fine needle aspiration. So that's how you basically do the thyroid classification of your nodules. So when you do like this and you use your calculator, automatically the classification comes here, and then the calculator will give you a recommendation. So you see how essential it is for you to do the calculations using the TIRADS calculator. So you can say that if we are done and we need to move on to the second, we just reset. There, reset. If you press reset, it deletes everything. Then you can do again for a different nodule. So what I want you to know is when you are reporting thyroid nodules, don't just report in general. You must report them according to the TIRADS format, like composition. Then you have to talk about this lesion is cystic, it is anechoic, it is wider than tall, it is smooth, and it is non-internal echoes. You're done. That's how you report a lesion according to the TIRADS. So this is the standard way, the universally agreed way of doing it. So if you do like that, it means that your report is universal. Every person all over the world, they understand your language because it's universally accepted and it's reproducible. So let's look at a different lesion. We reset there. So if we reset, everything disappears. Now, let's look at a different lesion now. Let's say that the lesion that in question now is solid. Then we click here. Then this lesion, let's say it's very hypoechoic. We click here. Let's say that it's taller than it is wide. We click here. Let's say that it has got extra thyroid extension. We click here. And let's say also it has got punctate echogenic foci. We click here. So when I'm using the calculator, there is no need for us to cram the points, to memorize the points. The calculator automatically does everything for us. So you can see the total score of this lesion is 14. And then, according to our calculator, it's now saying that this lesion is TIRADS level 5. So what are the recommendations according to this calculator? It's saying that this lesion is highly suspicious. So it's saying if the lesion is above or equal to 1 centimeter, fine needle aspiration is needed. So you see already under the comment section, you have to talk about that this lesion is above 1 centimeter, so fine needle aspiration is recommended. Then it's saying that if the lesion is above or equal to 0.5 centimeters, follow-up is recommended annually until 5 years. So every year, there has to be a follow-up of the lesion. So you see, this is a universal way of doing these things. If we do a sonar, you see a thyroid nodule like this. If it's going to be done in Pakistan, if it's going to be done in Romania, they are going to produce the same because they are using the same calculator and also using the measurement. So make sure that for every lesion that you come across in the thyroid, take the measurements and then you relate using the measurements. Again, let's do another one. We reset the calculator. So now it's now reset. When it's reset, you see there's nothing that is marked there. So we can now choose the features of the lesion that we want to deal with. Let's say this time around, the lesion is spongiform. We tick here. Let's say that it is hypoechoic. We tick there. Let's say that it is wider than tall. We tick there. Let's say that it is ill-defined in margins. We tick there. Let's say that it has got a macro calcifications. We tick there. So, according to this calculator, this lesion now has got a total score of 3 and TIRAD level 3. TIRAD 3 classification. So, the recommendations is mildly suspicious. So, fine needle aspiration is only needed if the lesion measures above 2.5 centimeters. So, if it is below 2.5 centimeters, it means no fine needle aspiration is needed. So, follow-up is needed if the lesion is above or equal to 1.5 centimeters at 1, 3, and 5 years. So, you said the intervals are already set in the calculator that this lesion is above or equal to 1.5 centimeters. You follow it after 1 year, after 3 years, and after 5 years. So you can see how different the different nodules will be interpreted according to the TIRADS classification. So it is very pertinent that when you're doing a thyroid ultrasound scan, you always take the size, the biggest dimension of the lesion, so that you can put it together with the TIRADS risk calculator, and then you make your report. So you report according to the recommendation. So the recommendation formulates part of your comment section of a thyroid ultrasound scan. So whatever comes on the comment section, it has to be from the recommendation from the calculator. That's how easy it is. So basically, that's the standard on how you do the thyroid calculations, or the thyroid malignant risky suspicion. That's how it is unveiled. So you don't have to cram it. As long as you've got Wi-Fi access, go to your Google or to your browser, then just type the TIRADS calculator, then automatically the calculator comes in. Then you relate the nodule to the 5 sub classification there. Then you are done. The TIRAD comes there, the recommendations automatically comes. Don't forget, also measure the size. You can see how critical the size of the thyroid lesion is. So this is it. I hope you have learned a useful trade. Thank you so much. Once again, my name is Mr. Chitumba. Don't forget to subscribe to our channel and share our videos. Let's meet again in our next lectures. Thank you so much.